Today's webinar, Improving Blood Pressure Control with the AMA MAP Hypertension Program and i2i tracks. As I noted previously, this is session 3 of our 3-part series, so the last week. And we started with an overview. Second week, we took a little bit deeper dive, and that's what we'll be sort of continuing on that theme to take a deeper dive into the AMA MAP BP program, as well as some of the components that have been built into i2i tracks. My name is Zach Clint. I'm the Vice President of Client Success at i2i Population Health. And again, appreciate everybody joining us today. Want to note that we are recording today's session, and we will make that available in a number of different locations so that people can digest the content of the entire series or today's with their staff or with anybody who is interested from here. We will take some extra time at the end of the presentation for Q&A. If you have a question during the presentation, please, this is a great opportunity to get those things answered. There's a Q&A section within the control bar of the Zoom application. If you scroll your mouse to the bottom, you'll see the toolbar opening up, and there's a Q&A section, and you can post your questions there. If we don't get to it for some reason, it also allows us to contact you afterwards and make sure we're able to answer those questions. So with that, turn our attention to the deck. Again, this is session 3 of the series, Act Rapidly. Want to introduce our presenters. Klodiana Myftari is the Director of Clinical Pharmacy Relations at the American Medical Association, and Josh Glueck is the Senior Director of Quality Management at i2i Population Health. Today's agenda, act rapidly to improve blood pressure control. So we're going to focus in on a particular component of the AMA MAP BP program. And as I've said before, talk about that as well as leverage tracks or understand better how we leverage tracks in order to bring some of that data to life in an application that you already have access to for the most part. And then last, we want to talk about some of the support opportunities that exist within the American Medical Association to try to drive improved blood pressure control. A couple of learning objectives that are appropriate for today. So noting we want to identify strategies that can drive improvement to the Act Rapidly MAP hypertension process metric and blood pressure control. And secondly, integrate the use of tracks to drive physician and provider actions on the MAP hypertension process metric for Act Rapidly. So with that, let me turn this over to Klodiana to take forward the content from here.
Thank you, Zach. And it's a pleasure to be here with all of you today to talk a little bit more about Act Rapidly and what does that mean in the context of our AMA MAP hypertension program. So for all of you who have had the opportunity to be part of our previous series, I know that by now you're very familiar with the M, which means measure accurately, obtain actionable, accurate blood pressure readings that can drive diagnosis of high blood pressure and assess blood pressure control. A, which stands for act rapidly, and what it means is really initiating treatment and or intensifying treatment for patients who have uncontrolled blood pressure. And P, partnering with patient to support patients and in their lifestyle modification, in their medication adherence and self-measurement of blood pressure in a way to support blood pressure control. Our focus today, as Zach mentioned, is going to be specifically the act rapidly. And really what I want to highlight on this slide, it is what some of the data that the science is telling us of key clinical care processes that it's getting on the way of controlling blood pressure for our population. The first one is inaccurate blood pressure measurement, again, something that it's been extensively discussed prior. The second one is treatment inertia, which means that most patients who have uncontrolled high blood pressure either are not treated or are suboptimally treated to manage the blood pressure. And then the third key clinical care process, it is really non-adherence, whether it includes non-adherence to medications, non-adherence to lifestyle modification, and or frequent follow-up. And these are the key clinical processes that the MEP program is supporting. So we're going to talk about treatment inertia, what it is and how we can overcome it. But before we go there, we're going to really identify why is this an important topic to address. What I'm sharing with you in this slide, it is a modeling study that was conducted by the CDC in collaboration with A Million Hearts. This study was designed to look at modifiable factors that can improve blood pressure control. In this modeling study, the blood pressure control of the population was at 46%. And what the authors did, they looked at each element, each modifiable factor, which include medication adherence, frequency of follow-up, and treatment intensification, to look at the impact that each of them independently will have on improving blood pressure control. And what they found is that if we leave everything else the same by focus only on improving medication adherence, something that currently is at about 54% for patients with diagnosis of high blood pressure, if we bring that from a 54% to 100%, that will lead to a population blood pressure control movement from 46% to 57%. So it will help, but definitely it's far from our goal of above 70%. If we keep medication adherence the same and focus on frequent follow-up, and if we see our patients every week, that by itself is going to lead to an improvement in blood pressure control from 46% to 68%. However, if we leave everything else the same, but focus on intensifying therapy, initiating and intensifying where needed, that strategy by itself will lead to a population blood pressure control of over 80%. And that is why, from a strategy perspective, focusing on intensifying therapy, it is very important to reaching the blood pressure goal. And this is not hard to understand, right? Treatment intensification can lead to better blood pressure control, better blood pressure values, which means improvement in blood pressure control. It can lead to decrease in cardiovascular events, which is really our aim, and improve survival. However, even with all the data that we have, even with a great understanding of what high blood pressure is, and the many classes of medications that are available to manage blood pressure, we see a significant therapeutic inertia when it comes to blood pressure treatment. And that therapeutic inertia, it is really shown when we look at the percentage of patients who have uncontrolled blood pressure and the number of medications that they're on. This is a graph that demonstrates that more than 30% of patients with a blood pressure above 140/90 are on 0 medications to treat blood pressure. And then another 27% or so are on only 1 medication class, which often it's not enough to get patients to a blood pressure control. I also want to recognize here that when we talk about blood pressure goals, really we're talking from the quality metrics, and we are thinking about the blood pressure less than 140/90. But for every clinician in this webinar, we know that the blood pressure goal for most patients, it is less than 130/80. So we have a way to go here to get our patients to the clinical outcomes that will lead to reducing cardiovascular events. So therapeutic inertia, which means really the lack of treatment intensification when indicated. It is complex because it is impacted by many system factors, patient factors, and physician and provider factors. So I'm going to go into some more details on the system factors, because I know that every time we talk with a clinician, whether it's a physician, a nurse, a pharmacist, everyone in the clinical team, lack of time, the time that we're spending with our patients becomes one of the first things that comes to mind. The second system barrier that impacts therapeutic intensification, it's really lack of resources and lack of access to care for many of the patients that we serve. When we talk about patient factors that impact therapeutic inertia or really have an impact on lack of treatment intensification, it is patient characteristic like their comorbidities and patient adherence, which is often dictated by their health beliefs, by the trust in the health system. And this is something that really can drive and support treatment and blood pressure control. And then when we talk about physicians, well, lack of knowledge. Often we see that physicians and other providers are not sure exactly which guideline to follow. There has been, when we talk about high blood pressure, there's different recommendations from different guidelines, but luckily those recommendations continue to be more aligned, with most guidelines suggesting that most patients can benefit from a blood pressure control less than 130/80. Biases and beliefs. Often as clinicians and as prescribers, we tend to overestimate the impact that the medications have on blood pressure control. Sometimes also we don't believe that the blood pressure values that we're receiving are representative of the patient's blood pressure, and that gets on the way on the treatment intensification. And the last, lack of actions. Sometimes if there aren't the right tools and resources that can support the action, it makes it hard for physicians and providers to actually take the next step. So in order to overcome therapeutic inertia, really the strategies need to focus on number one, increasing knowledge. And this has to be across the systems, across not only for the clinical team, but also increasing knowledge for the patients and family caregivers. The second one, it's replacing attitudes and beliefs. This is where the shared decision-making, collaborative communication, motivational interviewing can be very powerful skills that can support the building of trust between the patients and the care team, but also improve the communication between the care team members. Promoting action, working on specific tools and resources that can support the clinical team to take that next steps, whether it's registries, whether it's protocols, something that we're going to talk a little more. And then lastly, creating system change. This is really the hardest step and the steps that require most resources. When we talk about creating system change, one example of that, it's really building a team-based care, where every member of the team is empowered to practice at the highest level of their license and their educations and their skills to be able to support the patients where they are. And this is exactly what Act Rapidly is meant to do. Act rapidly means providing efficient, responsive, and effective medication for all patients with uncontrolled blood pressure. On the slides here, we have put the definition of the actual measure. And really, as you can see, the AMA suggested goal for this measure is at 30%. The measure itself, it's focusing on patients who have diagnosis of hypertension with blood pressure that is above 140/90, and we're looking for a percentage of visit when a new medication class was added. And I will go into more details why that is important. But again, the goal here is set as 30%, which may seem low. However, we do recognize that there are going to be cases when patients may not need a new medication class due to other factors that are playing a role in the blood pressures that you as a clinician may be seeing. The next slide, this is a slide that is designed specifically for the quality improvement specialists on this call, and it defines the numerator and the denominator of the metrics. This is important because the accuracy of the data, as you're going to work with different registries and identifying patients who can benefit from treatment intensification, the accuracy of the data is essential to drive that action that we're looking for our providers and other prescribers. So let's dive into specifically now, what is the evidence saying? What are the action steps that you as a clinician can take to overcome therapeutic inertia and act rapidly on blood pressure control? Well, the first step is highlighted in the slide, and that is use combination therapy, preferably as a single pill combination for patients who have a blood pressure above 140/90. This is a recommendation that is a guideline-based recommendation. It's recommended by ACC/AHA guideline of 2017. It is recommended by many international guidelines, including the newest European health hypertension guidelines of 2023 that recommend use of combination therapy as a first step in managing blood pressure. We are often, as in the medical field and in pharmacy, we're often taught to start medication at a low dose and go slow, titrate them to a max, and then consider adding a new medications. However, this is a strategy that is letting many of our patients who have uncontrolled hypertension stay uncontrolled for years. So it is really a failed strategy, and consideration to start patient on 2 medication classes at a lower dose when indicated will get us better outcomes. When we talked earlier, I mentioned how we tend to overestimate the impact that the blood pressure medication has on reducing systolic blood pressure. On average, when you start a medication for blood pressure control, from a low dose to a standard dose to a maximum dose, on average, we are looking at a systolic blood pressure reduction at 7, 9, and 11 millimeter of mercury, which means that when we are increasing the dose of medication, something that we often do in our practices, the systolic blood pressure reduction that we will get, it's maybe 2 millimeter of mercury, and that is not clinically significant. So, however, when we are adding a new medication class that has 3 times the blood pressure lowering effect compared to increasing the dose of the existing medication. So that is one fact. The second fact is that most patients with uncontrolled hypertension will need more than one medication to get their blood pressure to goal. And really, in all of clinical trials and landmark trials that are quoted on our guidelines, it took about on average, 2.6 medication classes to get patients to goal. So really, the hesitation and the trial to keep patients in a one blood pressure medication will not support the patient's blood pressure goal. And then to make this step even simpler, consideration for use of single pill combination can really support medication adherence. It improves blood pressure control, and it supports better health outcomes, including better reduction in heart failure, in morbidity and mortality due to cardiovascular disease. The second action step that supports ACT rapidly and helps to overcome therapeutic inertia, it is use of a hypertension medication treatment protocol. On the slide here, we're sharing an example of a protocol that we've designed here at AMA. And as you can see, this is a simple one-page protocol that allows the clinician at any point in time to see where does the patient fit into the cascade of where they are into their treatment, and then when do we need a follow-up. And the second part of the protocol, it is an example of a medication list. When we talk about treatment protocol, the benefit of this is that it supports prescribing at the point of care. So you want this protocol to be simple to find. You want to be able to read it quickly and have information in there that can, again, support any prescriber at the point of care. Additionally, this protocol can serve as a playbook for the entire care team. It is important that the entire care team has the same message for the patient. As we continue to work with patients and connect with them in different modalities, whether it is through face-to-face visits or through telehealth and telephone visit, which are very common specifically on the rural areas, making sure that the patient are getting the same information and the same education, it is important. And that's why treatment protocol supports that communication and, again, serves as a playbook for the entire team. I did mention that the treatment protocol will be effective if everyone knows where to find it, when it's easily, we can have access to it in an easy way, whether it's printed, whether it's a pocket card, whether it's just one click away. And again, it's easy to follow, and it has medication examples. And I want to pause here for a second and talk about the importance of medication examples. Often when we work with prescribers and when we talk about therapy, questions that come to mind from both the clinician and the patient is, number one, is the medication available to the patient? Number two, what is the cost of the medication? And often as a clinicians, we have concern about possible side effects. So working with a pharmacy or a pharmacist can help to build the medication list that can really make the protocol as a tool that can be utilized and strengthen its value, because it will allow you to know exactly what medications are available at your site, what form, based on the formulary, based on availability and the cost, and often based on the prescriber's behavior. Medications that are oftenly or more common prescribed by your physicians could be part of that medication list and continue to support the optimal use of treatment. So in summary, what we mean by ACT rapidly is, again, providing an effective and a timely medication for all patients with uncontrolled blood pressure. And the way to do that, and the way to overcome therapeutic inertia, is by using a combination therapy, preferably as a single pill combination, and by using a hypertension medication treatment protocol. And at this point, I'm going to pass it to Josh to talk to you about tools that will support you and your team on making these action steps doable.
Excellent. Thanks, Klodiana. That was excellent in tying together, the final stages of the MAP program and talking about the medication intensification. So thanks for that explanation. And we're going to move forward into tracks again. So last time we talked about tracks and how we measure accurately and we partner with patients. And this time we're going to try to frame our reference around medication intensification. So again, coming back to running the report in tracks, if this is your first time joining this series, or even if you've been here before, we like to review how to get to the report, how to access it, how to run it. So in your i2i tracks menu, you can go to the reports section at the top, and we have an AMA folder where you can access either the bundle, which is your report, or you can also access the dashboard. Okay. Now, if you don't see the dashboard, this is just another reminder. If you don't see the dashboard in your version, you need to get upgraded to version 7.6.30, and that will give you access to the dashboard. Okay. When you're going to run the report, you'll need to set up your date range, and you'll also want to stratify by your different indicators, right? So you can stratify by locations, providers, and another thing that we added in the .30 release is you can also now stratify by race and ethnicity. That's actually on any report, but could be interesting to be able to stratify these AMA reports as well by race and ethnicity. Again, trying to frame ourselves in medication intensification, maybe you want to run this by provider, right? Maybe you want to look at some panels and look at which providers have higher rates or lower rates for when you run this report and when you're actually analyzing the medication intensification component of the report. Okay. Once you do run the report, you're going to get to the screen. Now, this is broken out by location. Of course, you can also look at location, just as another example, and you can get your individual locations where you are implementing this particular program, and then you can compare that to other locations or, again, other providers where you're not implementing the program, and you can really see the effectiveness over time of how providers where you've implemented the MA and P standards have improved the quality of care and made improvements on those blood pressures. Another thing that a lot of folks ask about is, okay, this is wonderful, but I want to be able to get this to my CEO, or I want to be able to get this to my C-suite on a regular basis. I want to be able to look at the providers, how everybody's trending. I want to be able to create some scorecards. And so we do have report distribution. If you've never used the report scheduler before, there's some really simple email configuration that you can set up in your in the file menu that's in the upper left-hand corner. And once you get that set up, you can just set it up to run on a monthly basis. We usually like to look back for 1 year lookbacks or 1 month lookbacks, depending on which lookback period you're looking at. When we send it to the AMA, we actually send them both. So we send them the monthly lookback as well as the annual lookback. So you can configure all of that in here. If you have any questions on setting that up, we're always available to help you. Or you can also check out the help menu in Tracks. That'll also walk you through that tool. All right, so visualizations. Again, these are in version 7.6.30, and you can start to look at trending of your medication intensification over time. So what percentage of visits are actually receiving that medication intensification? And so as you start to look into these dashboards, you can stratify them maybe by provider or by other by your locations, and you can really start to look at the data and start to see where you need to make some modifications and what patients you need to start to reach out to. And speaking of reaching out to patients, when you run your report, you will always be able to right-click on any numerator or denominator. In this instance, we're looking at the medication intensification numerator. And you can right-click and say, show me patients that do not meet the criteria. Okay, so that's given us this list of patients over here on the side. And with any of these patients, we can take action. So I can identify patients that have not had an intensification. And in this example, we can take action on those patients. So what sort of actions can you do? You can print letters. Remember, you can print templated letters out of tracks. So you don't need to choose one patient and send a letter and another patient and send a letter. You can pick every single patient in this list and you can send them all the same templated letter. It'll automatically fill in their name. It'll fill in their address if you'd like to, stuff those into a windowed envelope and put some postage on it, and it's really easy to get out the door. We also have text messaging services, right? So you can send out text messages to your patients, really effective way to get them back in and try to engage in some medication intensification, okay? And you also have the ability to create follow-ups as well. And so I put a real quick example of what a follow-up looks like when you create this. Follow-ups are kind of like your sticky note system of i2i tracks. And I mentioned these in the last presentation, but I put some additional slides in here so that you can really get a sense of how effective this tool can be. So you put a description, maybe you want to put something like a follow-up for medication intensification. You set an active date that you're going to engage with that patient. You assign it to yourself or perhaps to a care coordinator that you'd like to engage in that activity. And then you can also put any sort of notes in there at the bottom. This can fit right into your Tracks Today screen, and you can see all the follow-ups that you have today, all the follow-ups that you have coming up in the future, and you can start to really manage those callbacks to get those patients in for the medication intensification phase of the MAP program. Another helpful tool, right? If you're trying to do some pre-visit planning, trying to get some indicators on your morning huddle, or maybe on your visit summaries, you can set up protocols. Now, there's other ways that you can set up alerts. Those are called schedules. Schedules, unfortunately, can't be set up on vitals, all right? So you have to set up a schedule and or an alert for your blood pressures using a protocol. And so, as I put in the notes over there on the side, only administrators can actually access this protocol section. So if you're not an administrator, you can still help. You can still create that search and let your administrator know that you've created it and that you'd like to implement it at your organization. And then you can create a simple search, just as I've created in the bottom right-hand corner, patients with hypertension whose most recent blood pressure is greater than or equal to 140/90, right? So this is going to show up on your morning huddle or on your patient visit summary. We'll show you first what it looks like in the morning huddle. And here's an example. So that green H indicates that this patient is a hypertensive patient. And in the bottom right-hand corner, we see our protocol coming up here, hypertensive patients with blood pressure greater than or equal to 140/90. You can also create something similar to what's in the report for medication intensification, right? So identify patients that are due for medication intensification and create another protocol and try to get patients back in the door when they come in. It'll show up right on the morning huddle, address medication intensification, or whatever you want to title it that makes sense to your organization to let you know that you want to engage in that activity. Okay. And last but not least, the patient visit summary. This is an amazing tool that you can utilize in the room, right? Morning huddle has all the patients coming in for the day, so sometimes you really don't want to take that into the room. You want to use it to prep with your team and engage and find out who's coming in, what they're due for. But the patient visit summary is a tool that you can take into the room because it's individualized. And so you can even give the copy to the patient. You can circle things that are important to them. You can show them what they're due for and why it's important that they do some medication intensification. I mentioned it on the last call. This is kind of partnering with the patient as well. It's getting them involved in the education process of this program. It's getting them involved to learn about why blood pressure management is important, why medication is important. And you can also show them the trending, as I have highlighted in the bottom center, of their blood pressures over time. So you can even pinpoint, look, here's the point that we intensified your medicine, and here's the point where your blood pressure started to drop off. And so, the medicine's working, the process is working, and really help to highlight the data behind why you're doing what you're doing. So again, highlighting some of the tools that you have at your disposal. Trax has a lot of other things that you can do. We've highlighted some of the best ways that you can engage in the MAP program here. At least that's what we feel. So some of the best tools that we have available. And if you have any other questions or you need other help in setting up any of these things, be sure to reach out to us or open up a support ticket, and we'd be happy to help you. Last slide. Sorry, I forgot about this one. This is just the setup. So under the printing and reporting, you can set up your patient visit summaries. And again, I mentioned last time, if you get lost when you're setting that up, chapter 25 of the help menu will guide you into setting that up. But again, if you need some extra help, we're here to help.
Thank you, Josh. And as Josh offered for you to reach out to him with any questions around tools and resources that are available to you, it's the same thing for our AMA team. And before we talk about how you can reach out to us, we wanted to share with you some of the resources that are available to you in the i2i University, including a metric user guide, a validation guide, and the webinar recordings that have been taking place over the last couple of weeks. When we talk about the metric user guide, this is important to take your time to review some of the resources that are available in the user guide. It contains a combination of information from the AMA MAP Hypertension Quality Improvement Program with the i2i Trax analytics and population health management. It offers a metric interpretation, which again can be very important when you're looking at the specific metrics and you're trying to drive improvement in those metrics. And it also includes many of the resources that AMA has available around hypertension program. That includes the example of the treatment protocol that was shared on the slides earlier, and again, many other resources that are useful to the whole clinical team and some that are useful to the patients.
We
Josh?
also have,
Yes.
yeah, we also have the validation guide in there. So this is a tool that we put together. And again, I give a shout out to Patty Bisson, who was instrumental in putting together this document. And what this does is it helps you to run the report, some of the things that we went through in the presentation. But again, I know everybody likes to have some things in written format, but it'll walk you through running the report, validating your patients, drilling down to the patient level. Your vitals come in through the interface, but if you ever notice any discrepancies, there's always the opportunity to drill down to the patient level, validate, and double check and make sure that your data is accurate. So this handbook's also going to be available in the i2i University.
And if this is not enough, well, this is all the learning series that were covered over the last 2 weeks that you can get access to through the QR code. This would be a great learning series to share with other members of your team. Especially this can be helpful in explaining why you as a hypertension champion are focusing this work. It also helps to improve knowledge and awareness of the clinical team and really create a culture with that focus specifically on hypertension control. So utilize this as a way, again, to engage with your team. And then again, if this is not enough, our team at AMA, it's happy to address and support you in any way we can. If you would like to engage with us in a more one-on-one approach, we'll be happy to support you on that. We will talk and go through our program, which is again an evidence-based strategy and action step, a program that has different supporting tools and resources. And above all, it offers a quality improvement coaching and practice facilitation that is based on a peer-to-peer coaching and support. And if you have questions on how to engage with us or just question about how to move forward, and if you are ready to really drive the blood pressure improvement into your organization, feel free to reach out to us through the QR code on the screen. And with that, at this point, we are going to open it for questions that we'll be happy to address.
I do see we have a couple of questions. First one directed, Klodiana, maybe more at you. What are some strategies that you found work well to change provider and prescriber behavior to support ACT rapidly?
Thank you, Crystal. That is a very good question. And I will highlight 2 specific strategies that we have found to be beneficial. The first one, it's really building a team-based care approach. It's the provider's behavior can really change when they know that their patients are safe. They can have access to the medication, that a monitoring plan is in place. And building the team-based care to support that is essential. What we are seeing is that many clinics are incorporating nursing visits to support monitoring of medications. We are seeing nursing working and intensifying therapy under a treatment protocol. Many clinics are incorporating pharmacy services under a collaborative practice agreement to initiate therapy and intensify therapy and support the monitoring. So that is really one strategy that we're seeing to be very effective. Another one is physician-to-physician peer consulting and discussions. What we're learning is that if there is a champion in your institution that really uses single pill combination and combination therapy, that uses a treatment protocol, sharing their experience and the patient's positive outcome from use of the therapy with their colleagues and their peers can really have a significant impact. Because physicians and usually prescribers, the main concern is, again, patient safety. So addressing their concerns and addressing them with a peer can make that behavior, can support that behavioral change. So these are really two strategies that we're finding to be very effective in supporting prescriber behaviors, in addition to using all the other tools that were just reviewed.
Great, thank you. And then we have another question. Josh, this is directed more at you. Is it possible to break out medication intensification metric by provider and then send to each provider, and then send each provider their performance on a set cadence?
Yes. So I didn't show the secondary screen when you're setting up the report scheduler, but you can choose the report and you can choose how frequently you want to send it and who you want to send it to. But there's also a secondary tab that's available where you can choose how you want that data broken out. So you can break it out by provider. If you wanted to, you could even break it out by each individual provider and send a version to that provider. Break it out a different set to another provider, send it to that provider. So you can either send out one giant list that's broken out by provider, or you can individualize it. Personally, I think it's easier and also advantageous for providers to be able to see where they trend compared to their peers, right? Gives a little bit of a competition, gives a little bit of striving to be the best, and I think that's helpful. And so I like that method, but if you want to, I've worked with some other organizations that like to roll it out a little bit slower at first and maybe just do one provider and two providers and do it that way. So whatever you think is the best at your organization, but you do have those options available.
Great, sounds like there's a lot of flexibility there. I'm not seeing any other questions at this moment, but we can pause for any other comments that you both might have.
I just want to add one more comment to Klodiana's response, which was about the team-based approach. I wanted to highlight something that she mentioned earlier, which is everyone practicing at the top of their license. If you've been to one of my presentations before, you notice that this is something that I always like to hammer, and really elevating everybody and making sure that they're doing everything in their power in their license. And so when you target that team-based approach and everybody is pulling their weight and everybody is engaging at the highest level that they're able to. The perfect example that she just gave was the nurse visits, right? Just coming in for a quick nurse visit and getting that blood pressure check. These are vital things in these sort of engagements. And I just wanted to really mention that one more time about practicing at the top of your licensing when you're engaging in that team-based approach. Any other questions?
All right, excellent. Klodiana, Josh, thank you both so much for sharing your expertise and walking us through the details today. I hope the participants have gotten a good understanding of the collaboration and the time and the effort that we put together with the AMA. I think providing or combining their expertise along and embedding those tools and metrics in tracks gives Trax users a great opportunity to be able to identify patients with hypertension. Then all of that data is about creating action and using those metrics to see trends and improvements. So I will offer, there were several opportunities offered or resources offered within the presentation to reach out and get additional information. I want to offer one more. Many of you are i2i clients. Your client success executive is well aware of the program and can help drive you towards resources if that's the simplest way to do so. So always feel free to leverage that person as well. So with that, thank you so much for participating today. Again, these resources in the webinars will be available for you to consume whenever you and your team have availability to do so. Really appreciate you attending today and for the series that you've been here, and wishing everybody the best. Thanks so much.
Thank you so much.
Thank you.